Welcome to Canadian Justice. I'm Christine Van Gyn, and today we're discussing medically assisted dying in Canada, including some recent reports of economically and psychologically vulnerable Canadians receiving a medically assisted death. Access to assisted suicide, also called medically assisted dying, has changed dramatically since 2015 when the Supreme Court of Canada struck down the criminal prohibition in a case called Carter and Canada. The patients in that case were suffering from severe illnesses, degenerative spinal stenosis and Lou Gehrig's disease, or ALS. But the law on medically assisted dying since then has changed quite a bit. It's now available not only to those with terminal illnesses, but to patients suffering from an illness or disability which cannot be relieved under conditions the patient considers acceptable. Some have called this a slippery slope that's resulting in the euthanization of vulnerable people. Others see medically assisted death as a medical service that permits people to die with dignity, without extended suffering, and that acknowledges autonomy. Here today to discuss this debate are two experts. Yuen Yi Zhu is a Canadian Senior Research Fellow and lecturer at Oxford, and Dr. Sonu Gained is the Chief of Psychiatry at Humber River Hospital and a professor at the University of Toronto. Thank you both so much for joining me today. Let's start with the basics, Dr. Gained. What's the criteria today to qualify for assisted suicide in Canada?
Well, first, let me start by thanking you for taking on this challenging topic. It is very complex. And thank you for the introduction as well, because it shows how quickly we have come to the criteria we currently have. I should also say at the beginning that I am not what's called a conscientious objector. I actually am physician chair of my hospital MAID team, but I've become very concerned about the precipitous expansion that we've had. So what has now happened, you mentioned the law came in place in 2016. And at that time, you needed to have a grievous and irremediable, meaning a condition we can predict will not get better, medical condition. And that was defined in various ways, but one of the safeguards at that time included that your death needed to be foreseeable, reasonably foreseeable. That safeguard was challenged and overturned by a single judge in a Quebec court. It was not then taken to the Supreme Court by the federal government. And that's the basis of our new law, with the removal of that safeguard. So what that means is that as of 2021, as of last year, you could get MAID even when death was not reasonably foreseeable. In other words, if you were disabled and not dying. And that's opened up two tracks. So there's now one track where if your death is reasonably foreseeable, and keep in mind that always meant up to about 10 years. You did not need to be at death's door. You could have 10 years left of life. So if your death is reasonably foreseeable, you can then get MAID with no waiting period. There used to be a 10-day reflection period that was eliminated in 2021. So you can, and people are getting MAID the next day. On track two, the new one that opened, non-dying disabled, then there's a 90-day waiting period, which is, of course, something that people wait for years for treatment for chronic illness. But anyways, those are the two tracks that are now there.
So, Mr. Zhu, you've expressed some concerns about the changing criteria for assisted dying. What are some of those concerns?
Well, thank you, Christine, for addressing this very important topic, and thank you to Sonu for being here as well. Since the new law, Bill C7, was received royal assent in 2021, there have been reports in Canadian media of people who have chosen to use MAID to commit suicide with the assistance of doctors for essentially socioeconomic reasons. Or to put it a bit more bluntly, people in Canada today are choosing to die at the hands of doctors because they're too poor to live with a level of dignity with what the governments are providing them in terms of financial support. Now, of course, the new legislation does not make it legal for people to commit suicide if they are poor because they are poor. However, if you qualify for MAID under this new law, and as Dr. Gain has mentioned, the new criteria is very, very broad. But if you qualify, and if you are unable to sustain a level of dignity in your life that you consider to be acceptable for financial reasons, you can choose to die. And that will be paid for by the Canadian government and the Medicare. Although if you want to continue to live under these limited conditions, you won't get anything extra in terms of welfare support. So actually this creates a really skewed set of incentives, where basically there are people in Canada who are choosing to die because they're too poor, essentially.
I want to get to some of those stories because there's some pretty shocking stories that I've heard, reports of people getting assisted dying for economic reasons. We've got to go to break, though, so we'll be right back. Now, Mr. Zhu, there have been some stories recently that really attracted a lot of attention. One was about a woman who had extremely severe chemical sensitivities and allergies. And I don't want to minimize that this was debilitating for her. But she lived on disability supports in government housing, but the chemicals and the smoke in the housing were very damaging for her health. So she applied for medically assisted dying because she couldn't obtain better housing. And that was granted, and she's gone through with the assisted suicide and has now passed away. So what more can you tell us about that case and your concerns about it?
Well, thank you. So this case was probably one of the more high-profile cases to have emerged, but it is by no means the only one. There have been many cases of people who have been approved for MAID for lack of housing, for lack of placement in long-term care facilities, and for all sorts of reasons. And what I have to remember is that those cases which have become public are only a small subset, as far as we know, of the total universe of cases where socioeconomic factors were involved, because there's no requirement for the government to collect data about the socioeconomic background of people who go through with MAID. And so the cases which come to light tend to come to light because the families have gone to media, or because sometimes the people who have chosen to go through MAID have gone to the media. But this is something that we are seeing more and more of it. And despite the relatively limited media coverage in Canada, for instance, I don't think CBC has really covered the issue at all since Bill C7 was passed. This obviously creates all sorts of moral hazard. I think it's fair to say that regardless of the politics, no one wants to live in a country where your decision to live or to die depends on how much money you have. And yet that seems to be the country in which we live now.
Dr. Gain, is there anything you want to add to that particular case? And I'll add that a lot of advocates for assisted dying, for example, in Maclean's, they ran an op-ed by someone with Dying for Dignity, where they say, no, people are not choosing to go through medically assisted dying for economic reasons. So on one hand, we have advocates saying that. On the other, we are hearing cases like this woman with her allergies. So where is it?
So thank you for the question, because I think we need to recognize that different people seek assisted dying for different reasons. And when death is foreseeable, as it previously had been, what we have found is that people of privilege, and the researchers find that they tend to be more educated and white, that they tend to seek assisted dying to avoid a painful death. As you expand it, as we are expanding it, then a different group seeks it, and they do seek it for life suffering. They don't seek it to escape a painful death, they seek it to escape a painful life. That is very different. And so in reference to the question that you asked, this to me is very disturbing. I think people are entitled to their own opinion, but they should not be entitled to their own facts. And I also think that that sort of sentiment is not simply false. I think it's misleading. That comes from some, in fact, Dying with Dignity Canada has on their website publicly posted as a myth that, quote, vulnerable populations can be eligible if they're suffering from inadequate social support. And they say no one can receive MAID on the basis of inadequate housing, disability supports, or home care. It is so misleading because nobody puts poverty as the reason they're getting MAID. But someone who has diabetes and is in their 30s and has dire poverty and loneliness, job or housing, that fuels life suffering. We have known that for a long time. It's the concept of total pain. It's about our cumulative pain. And in fact, a group of colleagues and myself, the expert advisory group on MAID, we did a brief which included a response to that so-called myth, because it is really terrible misinformation. And what we point out is that a poor, homeless, two-spirited Indigenous young woman suffering from trauma and depression will not list homelessness as the reason for her MAID request, but they will still be provided socially assisted death for their life suffering based on non-scientific assessments of assessors who can't even tell that the medical condition will not get better. That's given death. And just one final thing, if I can, Yuan, in a very excellent piece he wrote in UK Spectator, quotes the French poet, Anatole France, who says the law in its majestic equality forbids the rich as well as the poor to sleep under bridges, to beg in the streets, and to steal bread. I think that his ghost today would say Canada's MAID expansion forbids the rich as well as the poor. Sorry, in its majestic equality provides death for life suffering to the poor as well as to the rich. People seek it for different reasons.
One of the things that I'm interested in is the question of since it's been expanded, how many people are accessing it for terminal illness versus non-terminal suffering, as you're describing it. We've got to go to commercial break, but Dr. Gain, when we come back, let's talk about that. Welcome back to Canadian Justice, where we're discussing medically assisted dying laws in Canada. Now, Dr. Gain, since the criteria changed to allow not just access to medically assisted dying for terminal patients, but also permits it for non-terminal patients, do we know how many people are accessing it who are non-terminal? How common a problem is this? And is it going to increase? Is the problem going to increase?
So we have heard of anecdotal reports across the country, but in terms of the national statistics, there's always a lag in those being presented. So the latest statistics we have nationally are from 2020, and that is before this expansion to non-dying disabled. But I think those statistics are also very revealing, because what they show is that from 2016 to 2019, 3 years since the introduction, when death needed to be reasonably foreseeable, in that short time, 2% of all Canadian deaths were by MAID. And they increased year on year. And by 2020, which is the year before this latest MAID expansion, 2.5% were of all Canadians who died by MAID. They remarkably call it a growth rate in the death rate. A remarkable term. And some provinces are even higher. So Quebec and BC are at 3% and 4%, and some areas are even higher than that. Vancouver Island is between 7 to 9%, it's believed, and it's been dubbed the assisted suicide capital of the world. Now, keep in mind, this is all before people would be able to apply for life suffering. This is before the expansion to non-dying disabled. So, you mentioned earlier that some people had concerns about a slippery slope. When you think about those numbers, when you think about the rapid expansion to non-dying disabled, the planned expansion to people with sole mental illness by next year, with people, some expansionists talking about the need to expand MAID to children. To me, there is no slippery slope. We have fallen off a cliff.
I want to get to some of those issues, in particular the mental illness and access for children, if that's going to be a potential. But first, I want to talk about something that seemed pretty disturbing that you wrote about, Mr. Zhu, which is the concern that the government has looked into the cost savings of expanding assisted suicide. And now that sounds pretty dark. Helping a medically complex and vulnerable person kill themselves is cheaper than using taxpayer money to support them when alive. Is it as dark as it sounds? What can you tell me about what the government has said about cost savings of medically assisted dying?
Right. I mean, it sounds dark because it is dark, right? So last year, the Parliamentary Budget Officer, who is an officer of Parliament, published a report about the fiscal impact of Bill C7. So he crunched the numbers, and I'm happy to give you some of these numbers, which are remarkable. Under the 2016 law, assisted suicide saved the Canadian taxpayer $86 million a year. Under the new law, Bill C7, there are additional savings of $62 million a year estimated for the first year of its full implementation. By contrast, each case of MAID costs the federal government and the taxpayer $2,327. So it's a no-brainer really from a fiscal point of view. Long-term care for chronic conditions, for incurable conditions is expensive. MAID is cheap, and obviously that creates incredibly perverse incentives. Because in Canada, we are obviously committed to good fiscal governance, but I'm afraid that this is being used or may be used in the future as a rationale for expanding MAID. Now, of course, the report itself says that the cost savings are not a ground on their own for expanding were legalizing assisted suicide, but it is very hard to believe that at a time when the medical system, especially with aging populations, inflation, and other things going on, is coming under strain, it is very hard to believe that there isn't some administrators, some politicians thinking, well, MAID is a wonderful way to reduce some of the pressures in the healthcare system because it's so cheap.
Mr. Zhu, we've got about a minute, but have you heard any stories of people who have been pressured to pursue MAID? Are there reports like that?
Yes, so far it is anecdotal because it is this sort of evidence is not being systematically collected, but it was the case, for instance, of a man who was disabled, who essentially, he was in long-term care facility in Ontario, and they basically, there's no better way to put it, they abused him in order to try to pressure him into assisted suicide. Now the case is under investigation and he gives testimony to Parliament, so it is so it has not been corroborated by judicial authority. But I think there's no reason to doubt that this sort of thing is going on at a sort of low level under the radar across the country, and we simply just we really don't know what is the extent of it. All we know is that we have reports, credible reports of this happening in Canada.
It's incredibly disturbing. We've got to go to commercial break, but when we come back, Dr. Gained, I want to talk to you about the expansion of medically assisted dying for people who are suffering from mental illness. We will be right back. Now, Dr. Gained, currently medically assisted dying is not available for people who are suffering from mental illness, but that's going to change in 2023. Can you explain some of your concerns around that? And I'd say one thing that strikes me as troubling about it is that people who have mental illness, it's done in the name of autonomy. Allowing them to pursue assisted dying is done in the name of autonomy. But if they're suffering from a mental illness, how do they have the autonomy to consent to dying? Is that a concern we should have?
So I think the concern is actually a bit more complex in the sense that there are a number of things that interact here. Most people with mental illness do retain legal capacity. It's not that they become incompetent. However, the way they think does change. Think about it. When any of us is depressed, we think differently than when we're not, and we think the world is bad, the future will be bad, and I am bad. That goes into decision-making. But the bigger piece is that, we have been told and sold as a public that MAID is for an irremediable medical condition, a condition we can't get better. All the conditions before the course were like that. They were pretty well 100% predictably irremediable, neurodegenerative conditions. You cannot make those predictions with any mental illness. Even CAMH, one of the most respected apolitical authorities in the world, has said on this topic that at any point in time, it may appear that an individual is not responding to any interventions, that their illness is currently irremediable. However, there is not enough evidence in the mental health field for clinicians to determine whether that individual has an irremediable condition. So what that means is we will have subjective judgments not based in science, saying to people that I think your mental illness won't get better. We'll be saying that to them during their periods of despair. We'll be saying that to them when their despair could be fueled by suicidality as a symptom of mental illness. And then we will end up taking their life. And on top of it, keep in mind that with mental illness, there's a much higher correlation with poverty and other psychosocial suffering, all the things that Yuan was talking about. So what we've now done is taken people who are in a transient state of potential suicidality, converted it to a permanent death, fueled on life suffering. That's not autonomy.
I want to kind of pose the same question to Mr. Zhu about autonomy. Obviously, Dr. Gained has expressed his concerns here, but to play devil's advocate, people say that this is about autonomy, that even if you disagree with a person's choice to end his or her life, it's their choice. So what response do you have to that?
Well, autonomy is obviously a very important value in any society, especially a liberal one, but I think there's a very twisted conception of autonomy here. Firstly, as we discussed, many people who make this choice are under all sorts of improper pressures, economic and otherwise. And there's no autonomy if it is really coerced. But moreover, philosophically, the criminal law prohibits us from doing things all the time, even if we really want to do it. For instance, in criminal law, I cannot make a contract for my own murder, right? I cannot pay somebody and say, I sign a contract, you can kill me. That is illegal. I cannot agree to be sold into servitude. That is illegal. Autonomy is not an open-ended, unlimited concept. It has to be anchored in certain fundamental principles, moral, philosophical, or otherwise. And it is simply not good enough to say what that person has chosen because one, what sort of choice? And two, is this the sort of choice that we are happy to allow as a society?
We've only got about 30 seconds left. Dr. Gained, I want to touch back on your concern about children who do have increasing rates of mental illness and anxiety. Are there going to be age restrictions on medically assisted dying? Is this something we should be worried about for kids?
Right now, it's only available for adults, but there are expansionists who are seeking for it to be applicable to children. And obviously, there are self-evident concerns about that. Our brains aren't fully mature till we're in our mid-20s or later. The stuff that involves decision-making, our frontal lobes, that is particularly one of the things that develops later. And so now, we have laws that say you can't drink before a certain age, you can't vote before a certain age, you can't buy a gun before a certain age. But we're going to now maybe be saying, we'll help you end your life before a certain age, before we know if you could get better in 1, 2, 10, or 20 years.
Really, really disturbing. I want to thank you both so much for coming on today and talking about this.
Thank you.
We've heard today about the concerns around medically assisted dying and how it will soon be available for people suffering from mental illness and how it's not being limited to people with a terminal illness. As assisted suicide expands, do we have enough guardrails to protect vulnerable people, especially people who are economically disadvantaged or living with a disability? Is expanding medically assisted dying the right thing to do, or could it have devastating consequences? You be the judge. I'm Christine Van Gyn. Thanks for watching. And remember, a freer Canada starts with you.